When you're thinking about what you're eating or putting in your body, be mindful that you're not just eating for you, you're eating for you and a cast of millions, right? So you also have to worry about your health, but also sustaining your microbiome, which is also looking after your health as well. Hi, I'm Dr. Angela McKay, chiropractor and naturopathic physician. And this week we're talking about the gut-brain axis or the gut-mood axis. And it is Tactical Thursday. I want to talk about some tips to help you out with that. So we've talked about all the different neurotransmitters that your gut can make and signal to your brain and the communication between the brain and the GI tract, and that goes both ways. And we've talked a little bit about diversity in your microbiome. And so one thing that I always recommend to patients is that they switch through probiotics. Now, probiotics are not for everyone. Certain probiotics in certain conditions are not the right probiotic for you. This is especially true if you have Crohn's or ulcerative colitis. There's certain probiotic strains that you want to avoid. And it can be problematic sometimes for people with SIBO if you introduce the wrong probiotics or introduce them too soon. For people with SIBO especially, you want to not introduce any probiotics that have FOS. And FOS stands for fructooligosaccharide, and it's also known as prebiotic. So if you see something that says FOS or prebiotic, those are certain fibers that those gut bugs that are in the wrong place will really love living off of that food, and it'll cause you lots of symptoms. So for everyone else, and for those with SIBO at the right time when you're ready to introduce probiotics, I recommend switching through different brands periodically. So you want to find something that has a high volume of like several million. You want to find one that has a pretty wide diversity in the strain of gut bugs available. And hopefully you want to find something that doesn't have to be too fussy. So there are some really expensive probiotics that have to be refrigerated, and you have to be really careful with them and treat them gently. And I don't recommend those unless they're absolutely necessary. So some of my favorites we'll talk about in Friday favorites, but some of my favorites are actually over-the-counter ones that aren't too cost prohibitive. But even those I want you to rotate through so that you're getting different things every 3 months or so. That is all I have for you for Tactical Thursday. The other things that we've talked about that influence your microbiome include what you're eating, whether you're sleeping, whether you're able to be in the rest and digest mode. So keep track of all the hygiene things, and then I will talk to you next time.